everybody, my name is Rhys Barber. I'm one of the audiologists here at Audiology Associates.
And my name is Taylor Green, and I'm the other audiologist here.
You sure about that?
I think so. There's just two patients.
Two patients in this one. First one's mine, which is a nice, quick and simple one. Second one's Taylor mastoid clearance. All you mastoid cavity lovers out there. So the next one is definitely one for you to have a look at. So I've got the easier of the two videos today. So mine was a pretty straightforward, deep plug, causing lots of issues as far as hearing was concerned. See a little bit of sort of dead skin wrapping around the bottom of that. But it looks lovely and healthy. Patient hearing a lot better straight away. There was just this little kind of ridge, so I attempted to peel some of this, but this is a very thin peel, this one.
Ooh.
Yeah, and it's right in that sensitive portion of the ear canal. I'm just going to try and lift.
Yeah, it's like multiple layers, isn't it?
It is. I'm trying to peel it away. I don't think we get it all the way. You can see it's going all the way down to the eardrum now. So yeah, we just clear that little space there. I've got a little kind of flappy bit there, it doesn't want to come away. So I would advise the patient to use a little bit of olive oil. That will migrate out on its own, that last bit.
Yeah, that's the super sensitive portion of the ear canal. So yeah, this was a patient who attended one of his regular appointments. I'd say regular. This particular patient comes a little bit more often than the sort of recommended. Recommend. So just felt it needed clearing. So doesn't look anything sort of out of the ordinary at the moment, but you'll see once this starts coming away, you'll see all the, where the operation has took place. And if you've never seen a mastoid cavity before, this is not going to look like a normal ear canal.
No, most definitely not. So your mastoid bone is the bone that sits behind your ear. So it's the hard bit just behind your ear. That's your mastoid bone, and that's like a honeycomb bone. So it's got lots of almost like air pockets inside it. And with that bone, sometimes you can get infection that passes into those little pockets. When it gets in there, it's ridiculously painful. It's really, really painful, and it's very difficult to treat. So a lot of the time, if you're getting repeated infections, what they will actually do is they'll remove the mastoid bone itself. So you end up with this little shelf here where all the nerves pass through the ear canal. Very difficult one, isn't it?
And typically, that's where all the dead skin and stored, and it is thick as well. Yeah. That's where it all collects. Now, this particular patient has a particularly deep pocket. So you'll see, it doesn't look like there's much there, but as we, eventually start to get this moving, you'll see just how deep that little pocket is. So the eardrum would be sort of off to the left here, so we're actually taking away all this skin that's up to the right.
There was a little clarinet there, I reckon. See, this is the problem now. You've got to go down to the fine end, which is great for the clarinetting, but it's just not going to carry the same power as that larger Zollner tube.
Well, I was hoping I was just going to be able to get rid of this little bit of dead skin here, and then carry on with the piece at the top. It's a tricky old one, this one.
It's not an easy one, is it?
I mean, there's been a few mastoid cavities that we've cleared which have been harder than this to clear. But they're never easy. I mean, we've had it on occasions where they've come in for a regular appointment, and there's been barely anything for us to take out, which is is great to see. But it is not going anywhere here. I have popped a little bit of... The only reason I've put oil in here, just so I put it out there, people are saying, why are you putting oil in? This patient has been told by their consultant that they are able to use oil if they feel they need to. So the patient has used, oil, not regularly, but he does use it occasionally. So, but I've put a bit in just to try and get this skin away.
It always goes tough, doesn't it? And you're always far more cautious with these mastoid cavities, especially because there's going to be a lot of scarring on the drum. You're going to get lots of these bits of skin. You can see just how hard Taylor's pulling on that bit of skin to try and get it out. But we've got to peel this, but never easy ones to do. No. You've almost got that little flat, see that lovely one there. I just want to go in and grab that one. That's where you're going now, I think. I've been eyeing that bit up, and I'm like, I wouldn't mind pulling that bit.
Gonna try and get
get
no.
out the way.
Trying to get it out.
I can see you trying to get the jaw around it.
Yes, it's got a good pull.
That's Oh no! It broke away, Taylor. You can see you looking at going, okay, where next?
Where am I going to go next?
Where am I going to go next?
Change the angle of the forceps here a little bit. There's another little edge.
Oh, you spotted that. I couldn't see that then.
Oh, is it?
Oh, that's peeling. Look at that. That's a nice peel.
Oh, I'm trying to reposition.
Yeah.
The ear canals, as you can see, the ear canals on mastoid cavity patients are really wide.
Yeah.
And a lot of the time, this is not too bad, but a lot of the time it's quite hard to get a good view because you can't really kind of rest against the ear canal because you're like too far over.
Yeah.
Ooh.
That's a good one.
Yeah. Hoping we're going to get some form of movement here. It's a really strange consistency because I can feel the resistance on it and how thick it is. But anytime we get a little pull, it's just tearing little tiny bits away.
You'll find there's always that one little linchpin piece, and when you get a hold of that, it almost peels the whole lot out.
Yeah. Oh, well, we're getting somewhere slowly.
Yeah.
Right, there's that whistly bit that was the bit that was clarinet.
I can see it all the way up around the top of there as well onto the right hand side. Yeah, this is a good piece if we can just lift. You just want to just start a little bit of a peel at the bottom here, don't you?
Yeah.
Which is what's happening there. Look at that go. Oh, it's peeling away. But that bit you just tore off, there. That's where we're going to go next. That didn't work either.
So basically, I think at this point we got this piece to the top right of the forceps.
Yeah.
Is basically what's holding a lot of this in place.
Yeah. You almost
I was going to say I think I give up with the forceps. So I think now that we've started to peel this, slightly, I thought, I'll have another little go of this piece in the corner here. As I start to give this a wiggle, like, just watch how deep this trench is.
You almost think that's just the surface there, isn't it? But that's the canal wall, but it goes probably goes in much deeper than that.
Oh, look at all that going down to the right.
Oof.
What I'm trying to do here is get a good grip, build up the suction, and then give it a little bit of a wiggle, because that usually very, very slowly starts to peel it away. And we'll always check in with the patients at this point, because mastoid cavity patients, they are a bit more prone to dizziness during the procedure, especially with suction. Look at all that coming away.
Wow. Yeah, they're far more prone to that sort of caloric effect, aren't they?
Yeah. It's a sudden change in temperature, but
good one, Taylor Green. Look at that starting to come.
It's really annoying because I'm getting the grip, but as I start to pull it, I lose the grip. But I can see it's coming. That's why I kept checking with the patient. Are you okay?
That's
Are you okay?
Heck of a bit of skin from that cavity, that is, isn't it?
Oh.
Thing is, it's whether you could get. I don't even know if you'd be able to grip it with forceps there.
It's such an awkward angle up to the right.
What's going on with that bit that's coming down at the top then? What's that?
I think it's all peeling around from the side.
Over,
That's what I'm trying to.
Oh, it's going. You can see on the left hand side it's starting to loosen there.
Yeah.
Whoa, flipping heck. That is a heck of a cavity, that is. Wow.
Patient's absolutely fine at this point as well. He's had it done a few times in the hospital as well.
They almost get a relief, don't they? After you finish, it feels a heck of a lot better.
But it's, patients unfortunately been unable to have regular appointments at the hospital. So he kind of comes to us in between, which is why it's been a bit of a longer period since we last saw him. But yeah, this is something else, this. Oh, come on. This is why it's really frustrating, because it looks like it's
almost
loose.
there, isn't it?
Come on.
You got a grip on something there.
I think it was that bit at the top that was...
it was flapping down all the time. But I don't know, though.
I'm going to draw it back slowly now. Try and get it all bunched up in the suction tube. Come on.
It's
just sheared away.
But it's drawn everything forwards, though, because that's taken the everything off the roof down now, isn't it?
Yeah. So I'm giving another little... I probably could have grabbed it with the forceps at this point, but oh, look at that coming away.
Wow.
Look how thick it is as well.
My goodness,
look at that.
See, that peeled everything out as well, didn't it? The whole lot just came out.
I think we end up leaving this little bit at the bottom here because this is, again, very, very sensitive. But yeah, you can see just how abnormal a mastoid cavity ear canal is. You know, if you've never seen one before, that's very similar to what you'll see. I mean, that was quite pronounced there. We don't usually see them that, well, I don't see many that deep anyway, but it's usually like a perfect little shelf up in the corner, but that was quite a deep one. But yeah, that was a rough one.
Yeah, that was
a fight. That was
fair play. Well, guys, thank you very much for watching our video again today. And if you do enjoy the videos, don't forget, always like, heart, share, follow, and subscribe. If you really enjoy the videos, you can also consider becoming members of the channel. That way, then you get to see even more videos every single day. But as always, guys, take care of yourselves.
Take care of your ears.
And take care of one another. And we shall see you for the next video. Bye, everybody.
Bye bye.